It is very nice to greet you again. In today's video we will talk about the following. How common are bladder stones in dogs? Bladder stones in dogs are a surprisingly common health problem, one that many owners are unaware of until their dog begins to show painful symptoms. These stones, medically known as uroliths or urinary stones, can affect dogs of any breed or age, although some are more prone than others. What are bladder stones? Bladder stones are solid mineral formations that develop in the bladder. Normal urine is made up of different minerals as body waste. These stones form when minerals normally dissolved in urine clump together and solidify. Over time, they can turn into stones of varying sizes, some as small as grains of sand, others as large as pebbles. How do I know if my dog has bladder stones? Bladder stones can form slowly and may not present any external signs at first. Over time, as the bladder lining becomes inflamed and painful, the dog will begin to show signs such as frequent urination, straining to urinate, passing small amounts of urine, blood in the urine, signs of pain when urinating, e.g., vocalization. In severe cases, stones can completely obstruct the urethra, preventing the dog from urinating. This can quickly lead to a life-threatening condition requiring emergency treatment. Why do bladder stones form? Bladder stones usually form due to a combination of genetic, dietary, and environmental factors. It is important to note that crystals in urine are different from bladder stones. Crystals in urine are common in normal dogs and can be present without associated problems. Problems begin when these crystals accumulate and form stones. Factors that contribute to bladder stone formation include urinary tract infections. Some types of bacteria produce substances that change the pH of urine, promoting stone formation. Diet. Some diets, especially those high in protein or certain minerals, can also increase the risk. Dehydration. Not drinking enough water causes urine to become concentrated, which can lead to stone formation over time. Breed predisposition. Some breeds have a genetic tendency to form stones. Types of bladder stones. There are several types of bladder stones, each formed from different minerals and under different conditions. The most common types in dogs are struvite stones, calcium oxalate stones, urate stones. Much rarer types of bladder stones include cystine stones, silica stones, and xanthine stones. How are bladder stones treated? Treatment for bladder stones depends on the size, number, and type of stone. Sometimes, stones can be mixed, a combination of two or more types, which complicates the picture somewhat. There are several options. Surgery. Sometimes, surgery under general anesthesia is required to remove large bladder stones. If your dog only has a few small stones, this can be done endoscopically with a small camera and forceps inserted through the urethra. Urohydropulsion. In some very specific cases, this technique can be used to avoid full surgery. A urinary catheter is inserted, and the bladder is repeatedly filled and drained with saline to flush out the stones. This is only appropriate for small stones. Diet. Surprisingly, some types of stones can be dissolved in the bladder by feeding your dog a very specific, prescribed veterinary diet. This is an excellent option to avoid surgery. Unfortunately, others don't. Treat the underlying cause with monitoring for infection, medication, hydration, and ongoing management. Final thoughts. Bladder stones in dogs are a relatively common but manageable condition. With early detection, proper treatment, and preventative care, most dogs can make a full recovery and lead healthy lives. As a dog owner, it's important to watch for signs of urinary discomfort and consult your veterinarian if you notice anything unusual. Providing your dog with plenty of fresh water, a balanced diet, and regular checkups can go a long way toward preventing bladder stones. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.